The main difference in the way that I do the surgery is in the use of a special type of implant called a polyurethane implant. And that has a very high safety profile. It's definitely the safest implant on the market, probably by at least 20 times. But it also has other benefits in terms of being able to use teardrop implants, which the majority of women want that more natural look that the teardrop implant brings. The main difference between those and round implants is that there's less filling at the top. So the way I explain it to patients is, with round implants, you always look like you've got a push-up bra on. Whereas with teardrop, you can decide whether you want that push-up bra look by wearing a push-up bra or you don't. If you just want to be subtle and not be sort of as impactful, then you decide how you look and when. So I wanted to cover briefly the history of breast implants. And in the 60s, the first silicone implants were made, and they looked something like this. They had a shiny, smooth covering, and they had a liquid silicone inside. Now, contemporary implants have a gel inside, so it's actually a solid, but it's very soft, as you can see, and it's very firm in terms of robustness and durability. They're very strong, as they need to be to last a lifetime. So the original implants, the problems with them were that some women's, probably even 50% in the long term, rejected them, and they formed a hard membrane around them. And to address that problem, other manufacturers came out with implants that had this special covering called polyurethane foam. And they did show a reduction in that encapsulation or hardening or rejection problem because they integrated with the tissues. So the original implant manufacturers, the ones that made the smooth implants, thought, well, all we need to do is to create a rough covering, and that rough covering is called a textured implant. And these are still the predominant implants on the Australian market, smooth and textured. Unfortunately, they both encapsulate or harden at the same rate, which is about 20%. So about 1 in 5 patients in the long term will need a reoperation because one or other breast has gone hard. But with the polyurethane foam covering, these implants, because they're more compatible, that rate is reduced to less than 1%. So only 1 in 100 patients with this sort of breast implant covering will need a reoperation for the most common problem, which is encapsulation. The other benefit with these implants is you can see this implant is a slightly different shape than a round implant. So this clear implant is round all the way around, and this has got a slightly different shape. This is called a teardrop implant. Most women will get a more natural result with this sort of an implant, and with those implants it's also a much bigger choice of shapes and sizes. So if we look at the models of the different types of implants that are available, and you can see that there's a large range in terms of the base shape, which can be oval or round, and also the way that they look from the side, so that's called projection. So if I turn them this way, you can see some stick out from the board more than others. On this side are the higher profile implants, and on this side are the lower profile implants. So there's a huge selection of implants that we can choose from if we're choosing the polyurethane foam covering.